University, and I'd like to welcome you to one of our NP Virtual Summit sessions. I have the pleasure tonight of being with Dr. Terry Peak and Dr. Judy Sieg. They are both alumni from our Doctor of Nursing practice program. They both are doing different types of work, and I'm thrilled to be able to hear the types of works that they're doing now that they have completed their DNP. Frontier Nursing University offers a postmaster's DNP program. It's available online, and it is 15 months, and it's a great program. I'm not biased or anything, but it is. It's a really great program, and hopefully they'll say the same thing when we talk. I think so. But if you're interested, please visit us at www.frontier.edu and click on our admissions tab, and you can see where all the information is about being able to enroll in our DNP program. So I'm going to start with Dr. Peak. And Dr. Peak, can you tell me how your DNP has impacted, having your DNP has impacted your practice as a nurse practitioner?
Absolutely. I am. Oh, go ahead.
Please tell us where you're from, too.
Hi, everyone. I'm Terry Peak. I am from Niles, Michigan, which is right at the state line of Michigan and Indiana, the southwest corner. And I work for a small community hospital. I work for a general surgeon bariatric group. There's 4 surgeons. And when I went to school to become a nurse practitioner, I knew that I wanted to have my doctorate. At the time, they were just talking about it. This was about 15 years ago. And I wanted to be at the level of care that was the standard throughout the United States. So it took me a little while to get there. I finally got to Frontier Nursing University. We did a lot of research. A friend of mine and I went back to school. And Frontier seemed to be the place to go. The type of education they offered, in addition to the accommodation of being an adult working nurse practitioner, was appeasable to us. So what that has done for me, having my education, I was hired originally to help grow the bariatric practice. It was extremely difficult to do because there was only one nurse practitioner, and I was scattered throughout several different areas, hospital and clinical practice. And going back to school not only helped me obtain my doctorate, but it also helped the practice understand that they need to give me a little time to help grow the practice. And what that offer is it allowed me to set to mind my thesis, which would have been group shared medical appointments. And Frontier provided me with introduction to my, I guess my mentor in this area. She had developed a practice similar for pregnancy called centering, and I was able to take that practice that she had developed and try and arrange it around the practice that I'm in now. And that is the bariatric surgeries for weight loss. And this has allowed me to do 6 monthly visits, including patients from anywhere from 7 to 10 patients. And these patients have the benefit of having a registered dietitian and a provider, which is me, spend 90 minutes with them and educate them prior to having their bariatric surgery. This has allowed better education for the patient and more comprehensive care between both the dietitian and myself, but it also allows for decreased provider burnout. My schedule prior to that was independent visits shared between a dietitian and myself for 20 minutes. So that allowed me a 10-minute visit with anywhere between 21 and 26 patients a day, saying the same thing over and over, trying to answer all the questions that were needed before patients were able to have their surgery. Doing it as a group visit, the patients are learning from each other and they're doing very well. This would not have been achievable had I not gone to Frontier and been introduced to an option where I could grow this idea into fruition to what it is today. Frontier was great for me for that, and I am very, very appreciative of what I've learned there. The instructors and the professors are extremely conscientious of their students, and they want to make sure that they have the best education possible. So I owe a lot to Frontier. Thank you.
Oh, thank you. Dr. Sieg, can you tell us your story and tell us where you're from as well?
Sure, I can. I'm from a small town in Indiana, Fordham, Indiana. And when I went to school to be a nurse practitioner, I said I was never going back to school again. So after I graduated, I seen Frontier was available online and I wouldn't have to travel. So I thought, well, what the heck? Always wanted to be a doctor, so I would go on and join a group, which I did. And so I was so surprised because I thought that I'd had such a well-rounded education being a nurse practitioner. And since I'd been taught some very basic, like how to research, how to gain information, and know what I'm talking about, I felt really like a really solid nurse practitioner. When I joined Frontier Nursing School, Nursing University, I was introduced to a very in-depth way of thinking and developing and researching my thoughts. And because of that, I decided that I wanted to help the population. So it was a very difficult program that I went through because I had included population and quality improvement in my program. And so I'm telling this because it kind of cycles up to what the next step is. And so I had some excellent instructors that encouraged me to develop plans, business plans. I'd never been managerial. And then I got into a policy class, and by this time I'd already learned how to think, write, and communicate with other people because we practiced that in every class. And so I went and used my research that I'd been taught how to do and was surfing my own space and had recognized or realized that my information was more up to date than their information that they had actually posted online. So I immediately wrote them and I was like, by the way, did you all know, that there's better information? And they wrote me right back. A coalition and said, absolutely we do, but who are you? And so they were very excited to know that somebody actually was working with chronic disease and had some information and wanted to share it with them. And I was immediately asked to join the group. And so from that group, that was Indiana Healthy Weight Initiatives, I was able to give information, be able to do some evidence-based information for them to be able to take back to what they call kind of the master group in order to get some policy going to improve Indiana's health throughout the population. And so my name was then given to another coalition, and that was a chronic disease advisory group, where I was invited, one of 50 people, to help develop the 3-year plan for Indiana's chronic disease. So I was very excited that I was able to participate because it had always been my dream to be able to help in population health. I had absolutely no idea how in the world would I do that. I knew how to, like Terry, I knew how to see one patient at a time, and I did enjoy actually educating them, but to do it on a grand scale, I didn't know how to do it. But through the coursework in Frontier Nursing University and staying pretty determined that I was going to complete it and being mentored by my instructors, which I'm still mentored, even though I'm a graduate. I am able to progress throughout my state and doing information. I've done some within my community, also to develop a website and allowed people to for example, take free information off of other adjoining websites like the Department of Agriculture, myhealthyplate.gov. And these are things, again, I had absolutely no idea how to do it, never even thought that the state even needed this program until I got on in and researched some evidence that people were asking for these things. So I think that I'm going to have a big future with helping the population. I'm really excited to do it. Within my own personal field, I continue to be a family nurse practitioner. I am able to spend 20, 40, and 60 minutes with my population, with my people. And again, just becoming an expert in chronic disease, I'm able to share what they can do to help themselves, and that's very exciting for me. So I have to encourage anybody who's thinking about being a doctor of nursing practice to come in and evaluate the coursework that would, an opportunity that's given to you. After graduation, I was able to do poster presentations at nursing, at nurse practitioner symposiums, and I have also started doing presentations. I did that at the Indiana Public Health Conference, and so I am 6 months out. So there's a grand scale of need, and I believe that everybody can help in this grand scale. And I hope to see you in our alumni.
Absolutely. Well, thank you. Dr. Peak, tell me about some of the opportunities that you've come across as far as presenting some of your work and sharing it as well.
I had the opportunity to do my actual project as a clinical trial at our clinic, and we are in the process of doing that. We are obtaining IRB approval, and what we hope to have done by the end of 12 months is to have enough information gathered to present at, there's a huge conference every year, and it's named Obesity Week. And it's the coalition of two large conferences made into one, and they've joined together, and it's under the name of the initials of ASMBS, which is the American Society of Metabolic and Obesity Surgeons. And what we hope to do is present our information that we've gathered on our patients to show the benefit of our group visits and the outcomes of patients with education, satisfaction, and increased weight loss prior to surgery. That is one area that we're excited about. We're also hoping that introducing this type of structured visit to the hospital through our practice will now move forward and hopefully develop into group visits and other practices. It's already being done in psychiatry, and even Weight Watchers does a form of it, but we're looking at family practice, possibly orthopedic, and that's kind of the goal with what our hospital is trying to do. So they're using us as a guinea pig as such, but it's also been a good thing for us because our patients are responding so nicely. We have, right now at this time, we have 6 group sessions started, and we are through the one that was started initially. We are now at the 5th visit, and they have a total of 6 visits prior to them going to surgery. So within the next 2 months, we should have completed at least the first group, and they will go on to surgery, and we'll collect our results from that, and then we'll keep on going until the end of the 12-month period.
That's
So
fantastic.
Thank you.
Fantastic. So let me ask you guys one more question. And how do you think your thinking has changed? Do you feel like now that you have this education that you actually think about things differently? And Dr. C, can we start with you?
Sure, and I absolutely do think of things differently. I give thought before I speak. And we all have this intuition, gut instinct that we know that there's a problem and that there's also a solution. Just as providers, we know these things. Now I know how to collect my information, how to research it, how to develop a statement of what the problem is and how to create a solution and implement it. So because of that, I now have just a thorough thinking of there can be a solution to a problem.
Fantastic. Dr. Peak.
For me, it's changed my thought processes completely in reference to how I look at patients. And not that we don't use our critical thinking, we do, but now I look at it as more of a 3 or 4 step process. Not only am I critically thinking about how to do the right thing for them, also how it would be better for the end outcome, not only during their hospitalization, but once they get home, once they are recuperated, and how to prevent a problem in the future. I think with having your doctorate, you know that everything is based on clinical research. So you look at it from that angle, and not only are you clinically thinking of the best way to help them, but you also think about the research involved. And I noticed that I'm relying, not only did we do evidence-based practice prior to having my doctorate, but I'm also looking for further information and how maybe we can make this as a more of a preventative situation as to just getting them out of the hospital.
Excellent. Excellent. Well, I can't say how, well, I can say I am very proud of both of you, and I can't say enough good things about the work that you two have been doing. It's just fantastic. Just fantastic. I'm very proud that you guys call yourself alumni here at Frontier. So I thank you for that. Is there anything else that you would want to share with anybody that might be considering doing a doctoral program?
I would like to share something. I think the program at Frontier is exceptional. Although it is a distance learning program, I never felt that I wasn't able to be in contact with my instructors. I can't tell you how many times I've called somebody on a Saturday and they have answered immediately and worked through a problem with me, or if they couldn't figure it out, they'd call me back as soon as they could. In reference to the computer problems, some of us have, we all are from everywhere in the United States, and the IT team was exceptional with working that problem out, getting us online. It was just, although you're not in a classroom setting, you feel like you're still part of a big team, and they're all supporting you and behind you. I was a little concerned about starting an all online course for my degree. Honestly, I didn't feel that way at all here. It was a wonderful experience, and I have recommended Frontier to multiple people, and I am working right now with 3 nurses who are in the Frontier program, going for their master's in nursing practitioner and then on to their DNP. So
Excellent.
in my little tiny town, so it's great.
Oh, excellent. Dr. Seek, anything that you'd like to share with us?
I would just like to say that Mary Breckenridge was a pioneer and she developed really the first nurse practitioner program in nurse midwifery